Welcome to the L Show. Last week was our very first show. And, you know, as we do a first show, there's so much that we want to get out there. And at times we just miss that mark a bit. So I've gotten some feedback asking about what the L means in the L Show. So I'm going to start off this segment talking about that in regards to the show and go ahead and lean into that. So, the L Show, what that L stands for is leaning in. And leaning in is an expression that refers to not shying away. And that is what this show is about, not shying away from any topic that is important to our health and well-being, no matter how unnormalized it may be. As a group of women maturing past the age of 40, our concerns and what matters to us have naturally evolved during this transition. But we don't find that our concerns are spoken about or truly marketed to. And I want the L Show to serve as an educational, inspiring, entertaining, and celebratory beacon that reflects what's on our minds and the issues that we face during this time in our lives. Throughout the L Show, we're going to lean into open discussions with different experts in their fields about topics like hormones, menopause, libido, self-acceptance or skin health, weight loss, anti-aging, alternative medicine, food as medicine, vitamins, supplements, hair loss, and much, much, much more. So that is what the L Show is all about. I do want to make this statement that our content may not be suitable for all audiences, and that the information presented in this show is not intended to replace the advice of your healthcare providers. So I am your host, Dr. Nicole Eastman. I'm a pharmacist and the owner of Rose Pharmacy and Boutique Apothecary in Cornelius, North Carolina. I am on the corner of 1 Norman and Jeton Road, right behind the McAllisters and Circle K. It's funny. Where I'm located, my sign is on the back of the building, but you can get to me from the front of the building through the breezeway. So it's not as easy as I had hoped it would be, but now people are finding me, so that's great. But just know that I am right behind that Circle K in McAllister. So what do we do at Rose Pharmacy? My team and I, we compound medications, which means that I make medications based on a provider's prescription, personalized to each client. We also provide holistic alternatives like supplements, vitamins, and much, much more. You can find out more about us by checking out our Instagram at Rose Boutique Apothecary, Facebook, Rose Pharmacy and Boutique Apothecary, and also our website at roserxboutique.com. So my guest today is Dr. Josette Guifridda. Did I say that right?
Yes.
Okay, perfect. She is a doctor of nursing practice. She is also the owner of Refresh Medical Spa and Wellness here in Cornelius. Her website is refreshlkn.com, and her Instagram is at refresh_lkn. She has been a nurse practitioner since 2001. She worked in primary care and transitioned into medical spa and aesthetics in 2021. And she has dealt with this issue that we are talking about today and what we talked about last week. She deals with it quite a lot. So first question I have for you, what made you leave primary care?
That's sort of a loaded question, but one that I will gladly answer. So I've been a practitioner since nearly the turn of the century, literally.
Okay.
And had entered into aesthetics a few years after that and kind of did both for quite some time. And in 2021, it just became clear to me that it was time to transition full-time into aesthetics and wellness. And I can't tell you how wonderful it is when my former clients reach out to me and they're like, I found you, or
Yes.
they'll come in almost like they're finding a reason to come in and see me. And I love that. So yeah, it was definitely time. You know, I felt like I did my part during COVID and had opened up the med spa earlier that year, and just it was time to transition.
Yeah. So you say that like it's exciting when your clients find when they find you. My pharmacist who works for me, Angela Jenkins, she was like, oh my gosh, when you came in this, oh my gosh, that's her. I cannot believe I found her. So yes, that is absolutely amazing.
Small world for
Small,
real.
small, small world. So, what we're going to do is I'm going to recap last week. This is our Hot Girl Summer Series. So, this is the second installment of that series where last week we discussed characteristics of a hot girl, hot flashes in sleep, mood swings, libido, mental health, and self acceptance. And our focus was really around those self acceptance tools with our previous guest, Miss Dorothy Diana, who gave us a great natural and sexy perspective on how to lean into the transitional changes of hormonal fluctuations through a number of very interesting practices, circuitous movements, preparing your mind and body for the changes, and making it beautiful. Menopause is not a death sentence. And for those of you who missed it, you can, if you follow WSIC News on Facebook, you can watch or listen to last week's episode. So this week, our topic is women grabbing testosterone by the testes. Men, don't be nervous. Don't be nervous. Don't have to cross your legs. This is about this is about us and introspection, not a physical assault. Okay. So it is no secret at all that testosterone plays an integral role in male health, from libido and muscle mass to fertility. We have all heard the commercials for low T treatments promising to restore the manly man. And as I was preparing for the show, I was paying attention to just the number of these advertisements. And I just couldn't help but notice how the effects of low testosterone on female health has been profoundly overlooked and has caused some unnecessary suffering. So let's talk to this. So why is testosterone important in women?
Well, similar to men, women experience, low sex drive, lack of energy, fatigue. Well,
Mm-hmm.
men don't experience vaginal dryness, but that's one of
Yeah.
the signs in
Right.
women. Depression, anxiety, thinning hair, dry skin. And in women, they'll present to a provider and say, "Help me. I'm feeling this way. I'm feeling tired. I'm
Mm-hmm.
feeling depressed."
Mm-hmm.
And, maybe it's, "Oh, you have depression. Let's treat you with this medicine," rather than, "Oh, maybe we should look at um, your hormones." A lot of
Mm-hmm.
times, though, people do, want us to look at their thyroid, and thyroid can
Mm-hmm.
play a huge role.
Mm-hmm.
But let's look at the testosterone level and see, can that
Mm-hmm.
help increase your energy and make you feel better overall and help with
Mm-hmm.
your libido? Because some of the
Mm-hmm.
medicines prescribed for depression can worsen
Can
your
worsen your
Yeah,
libido.
exactly.
Exactly,
Yeah,
exactly. So typically when these women come in, they don't even think about. They're not thinking about low test. They're just
exactly.
telling you, "I'm just feeling tired. I just
Right.
don't have any energy and
Mm-hmm.
whatnot." And it's you who's like, "Okay, you know what? I need to,
Right.
bring it back to there's a possibility that that's something that's going on."
Exactly.
Gotcha, gotcha,
Exactly.
gotcha. Well, I will tell you that the brain fog is real and the low
Yes.
energy is real.
Yes.
All right, so when we get back from break, we are going to discuss the symptoms of low testosterone, some more about that, and also we're going to discuss some fun facts, and we'll be back with you. Thank you. And welcome back to the second installment of the Elle Show Hot Girl Summer Series, where last week we focused on the characteristics of a hot girl. And this week our topic is women grabbing testosterone by the testes. I am your host, Dr. Nicole Eastman, pharmacist and owner of Rose Pharmacy and Boutique Apothecary here in beautiful Cornelius. And I am here with my beautiful guest host, Dr. Josette Guifridda. I said that right,
Yes.
right? Okay, owner of Refresh Medical Spa and Wellness here in Cornelius, where we are discussing grabbing that testosterone by those testes.
That's right.
So, Josette, so in men, we know T regulates libido, bone and muscle mass, fat distribution, as well as red blood cell and sperm production. We know a small amount of testosterone is converted to estradiol in the form of estrogen, and in females, most of the testosterone is quickly converted into estrogen. So in men, most of the testosterone remains testosterone, right?
Right.
So give me some fun facts because, again, we don't think about testosterone from a woman's perspective, but give us some just fun facts about testosterone in women.
Well, something interesting, I was trying to make sure all my numbers and everything were up
Yeah.
to date. So it is amazing how women are really underrepresented in the low T world. You can find out 1 in 4 men lack testosterone beginning in their 30s.
Yep.
But there's no number like that for women. So women produce 3 times the amount of testosterone than they do estrogen before menopause, which is very interesting.
That is very interesting. You're like, what?
And we'll talk about the goal of treatment later on because there's some misperceptions there. So
Yes.
1.2 billion women, according to the WHO, will be postmenopausal by 2030. And we'll talk more about what menopause and postmenopause, having no hormones, is like.
Yes. Poster child.
Yeah.
For me was, okay, go ahead. Yes.
And so, it's really important that we get the information out there that if you're not feeling well, maybe it's not your thyroid and maybe you're not depressed. You're having symptoms of depression, but we need to look into the whole aspect, your whole being. So with that, we use compounded hormones frequently, and my jam, what I prefer to write. So can you speak to what a compounding pharmacy is? Because I feel like it's a little bit more in the media these days.
Yes.
So speak to that and what a compounding pharmacy is, who regulates you, because that's a big thing. We hear FDA and that kind of thing. But, we all are guided by boards and that kind of thing. So.
Right. So, okay, so compounding pharmacies, we produce customized medication pursuant to a prescription that a provider writes for a patient. Now, I don't want to get too technical and talk about the different sorts of facilities, but my facility is one that has to do it based upon the prescription being written for a patient. So we get past that. I get a prescription in my hand, and it's written for some medication that is not available in the marketplace. You have made the decision that there is something that is better for your patient, that needs to be totally specific. And hormones are really the best example in this conversation. So, when you think about what's available in the marketplace with regard to hormones, there are synthetic hormones that are out there, and that is not really appealing for many. And so bioidentical hormones are the hormones that we use, and those are the hormones that reflect. It looks like what's your body already produces. So those are the ingredients that we use. We use bioidentical hormones to make whatever strength you want of whatever. It could be estrogen, it could be testosterone, it could be progesterone, and none of this is synthetic. So we make it based upon what you want for that patient, based upon the strength that they need, in the form that they need it in. And so, yes, so we're doing this. And so, of course, like, okay, wait a minute. Like, how can you guys do this? Well, we are regulated. We're regulated by the Board of Pharmacy. There are requirements, there are rules that we must follow when we are compounding. We just can't say, "Oh yeah, I just want to compound." Just
Let me throw some of
yeah,
this
let me
in
throw
there.
some. No, you can't. You can't do that, right? So it needs to be an ingredient that has what we call a USP monograph. It also, or it needs to be a medication that is in a formulation that is available in the marketplace. And it can't be an exact copy of something that's already in the marketplace.
Right.
So, but again, that's not what we do. We're doing this pursuant to having you've had a conversation with your patient, you've looked at labs, you've done all of this stuff, and you're like, listen, they need this strength, and I want it to be bioidentical. Truly, compounding pharmacy is, so I had a colleague that called, we're the MacGyvers of medicine. My pharmacy student who is interning with me right now, Bria Diorio, she's like, yeah, it's like kind of bartenders. We're like the bartenders for providers. A little of this in here, a little of that in here, exactly. So that simplifies basically what it is that we do. But we try to make sure that, again, that we are meeting the need of your patient at where they are.
Right.
We're meeting them where they are. We're not forcing more on them than they need.
Right.
We're going to give them what they need specifically.
Exactly.
So yeah. So that is in a nutshell. Did that answer the question?
Yeah.
All right. Wonderful.
Yeah.
Wonderful.
I had one more question.
Yes. Sure.
So when I write the prescription, I'm regulated by the DEA. And
Yep.
So testosterone is actually considered a controlled substance, meaning I have to have a special license in order to prescribe it. Can you explain why testosterone might be considered a controlled substances and how that's handled?
Yeah, so testosterone, of course, has gotten, and I was going to speak to this a little later too, but testosterone has gotten kind of a bad rap, right? So, so because when people are like, oh, so he's huge, he must be taking testosterone, right? But testosterone is there for replacement, right? So we use testosterone to replace testosterone levels. We need it to get to where we need it to be. Anabolic steroids is when we are getting into people wanting to overuse. So it's all based upon dosing, right? So people wanting to overuse to bulk themselves up for whatever, or make their performance better, right? So that is where testosterone got the bad rap. Testosterone in itself is legal, right? And it is considered a what we call a C3. It's on in that category of controlled substances because, of course, it's your ability to become addicted to the substance is a part of the classifications. But testosterone, again, the bad rap that it's gotten is just
adds to the mix.
Adds to the mix. But it is a controlled substance. But what I have in my store, nobody is trying to
jump over the counter.
Jump over the counter for. So, but yeah, it's I always try to kind of take people back to there. It is a necessary thing for folks when we're talking about quality of life and health issues. So, but yes, that is the deal with the whole testosterone being controlled. And yes, having a DEA license is absolutely necessary, required for you to be able to write for it. Yep. So
I need to renew mine soon.
Yeah. Yes. Write that down on your notes right there, Simi. So, all right. So let's talk about like the symptoms of low T. So, and we've talked about this already, but again, when we're talking about low T in men, they're having all of the issues with their libido, with maybe some weight gain. And you mentioned that in women, we have the same things. But how does it differ in their in the symptoms that men experience? Like, is it to the degree? What's like the degree?
So typically, their major complaint is low libido, decreased strength, fatigue, and maybe some grumpiness and that kind of thing. Women, when I see them, typically their number one complaint that tells me they're probably low in T
Yeah.
is decreased libido.
Mm-hmm.
100%.
Mm-hmm.
Also, a little fatigue and that kind of thing.
Mm-hmm.
When they come in, I can pretty much tell what I think. They're going to be estrogen dominant, or they're going to
Yeah.
need some estrogen and some progesterone and some T. But
Mm-hmm.
yeah, so that's basically it: the low libido and
Yeah.
the fatigue.
Okay. Okay. So, all right. So the benefits of adequate levels of testosterone in women, like
Mm-hmm.
what's the benefit?
Skin, nice skin.
Yes. Yes.
Yes,
Yes.
yes.
Right.
So your hair may improve,
Mm-hmm.
decrease brittleness.
Mm-hmm.
Vaginal dryness may improve.
Mm-hmm.
The fatigue, depression,
Yeah.
those may improve.
Yeah.
Preventing osteoporosis or helping
Mm-hmm.
to prevent osteoporosis, increasing your muscle mass to a normal degree to help support your bones, not
making
to,
you. Yes.
yeah.
Hello.
There's a lot of
Hello.
myths, and you tell me when I can tell you what some of those
Yeah.
myths are.
Yes, I think again we are leaning into these subjects and nothing is off limits. So I think we're going to talk about some of those myths when we get
Nice.
back from our commercial break. All right. See you then. Welcome back to the second installment of the L Show's Hot Girl Summer Series, where last week we focused on the characteristics of a hot girl, and this week our topic is women grabbing testosterone by the testes. I am your host. I know we just want to grab the ball, grab this and just say, hey, this is, our stress
We're
balls.
grabbing it.
We're just yeah. So I'm your host, Dr. Nicole Eastman. I'm pharmacist and owner of Rose Pharmacy and Boutique Apothecary in Cornelius. And I'm here with my guest host, Dr. Josette Guifridda, owner of Refresh Medical Spa and Wellness here in Cornelius, where we are discussing women grabbing testosterone by those testes. So before the last break, we were going to discuss some of those myths around testosterone for therapy for women. So let's talk through some of those.
Yeah.
What do we hear?
I think number one is women being treated with testosterone may fear that they will become more masculine. They're going to grow hair on their chest and have deep voices. Right. And I have to say the number one side effect that I rarely see, but that can happen, is acne. And that is like easily fixed or resolved by skincare treatments, adjusting the dose, obviously, just to get them to the right level, maybe checking a little bit of blood work, making sure their thyroid is good and that there's nothing else at play there. But then, clear up the acne. We both have great treatments. We've got some devices we can use.
Absolutely.
If there's, anything else going on. But so I think that's the biggest myth. And it's just, no one checks, so no one really knows how prevalent it really is and how women can be so affected. And we want to get rid of that fear. We're not going to turn you into,
we're
big muscular.
We're not going to turn you into, the muscle builder that we see.
Exactly.
Mr. America, is that, or Mr. Mrs. America?
Yes, something like that.
Yes, right. So, getting over that fear. So women just need to understand that it's testosterone is necessary for our function, right? And if there is some sort of side effect from the testosterone, we have ways to treat that side effect. That should not outweigh our getting to our best selves, right?
And I do have a couple clients who were treated previously, not by me, who've come in and said, I absolutely cannot take testosterone. And I said, well, let's see what your levels are. Let's check your DHEA, support those things around it so that we can hopefully raise your testosterone naturally without adding to it and adding to the, possibility of maybe a little feeling more aggressive or a little more anxious or the acne.
Right. So essentially, if I'm thinking of a commercial, so the commercial for a woman with low T, I could see.
What commercial?
Like, I'm just saying, we're making it up. We're making it up as we go. I'm just saying. So commercial, we have to. So commercial for a woman driving in a car. She gets cut off. A woman with low T, she may be, she may cry.
She'll cry about it.
About it. But too much testosterone, she may,
the road
rage, give the finger or whatever, lay on the horn or whatever. But a kid.
I need my testosterone.
Yes, exactly. So, all right. So let's go ahead and segue into some treatments. And actually, let's segue into how you approach your therapy. Whenever somebody comes in, they're telling, hey, I have these symptoms, XYZ. Tell me kind of what your process is.
Yeah, so basically we sit down and we have a conversation. They fill out some forms ahead of time so I kind of know what I'm looking for. And typically looking at that, a lot of times I'm like, oh, they need this, 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 and this. But, we'll sit down, have a conversation. What bothers them the most? Whether it be, some of them, it's vaginal dryness or, I have zero desire or I have this belly fat or any of those things. So we'll have that conversation and I'll decide the best form of finding out what their levels are. Typically, I'll do a blood draw if they're not on any hormones currently, and we'll check their estrogen, progesterone, DHEA, binding globulin, all the good things, and their free and total testosterone, and go from there. Then I sit them back down, say, this is what I recommend for treatment. The prescription goes over to Dr. Eastman, and then we do a complimentary consultation again at a month, and we say, okay, how are you feeling? They may say, oh, that progesterone made me so fatigued, or the testosterone, I feel great, or I have a little bit of acne, or so on and so forth. And then we adjust the dose. And then typically I'm checking some labs again in about 8 weeks.
Okay.
And initially I'll check some other things too, the testosterone, cortisol. Cortisol is a big one. And in my opinion, checking a saliva 4 times a day for 1 day, it can be a rough test. There's a lot of saliva.
Yeah. I know about that test. I'm like, I don't have enough spit to go in this.
I'm like, it's going to take you about 30 minutes.
Yes, exactly. It's nuts. Yes.
But that's a really good indicator of, do you need a little ashwagandha to help with the anxiety?
Yeah.
So painting the whole picture. And when we do the follow-up, we look at labs, and some labs can be kind of hard to pick up. I sometimes have a hard time picking up progesterone in some follow-up labs, whether it be in a saliva test or blood test. So I treat based on symptoms. Obviously, we don't want your numbers way up here.
Right.
But, if they're, we detected some or noticed some improvement, but I speak to you and you tell me I'm feeling great, then that's what we're going with. Or if I notice an improvement in this, but not this, then we're making those adjustments, and then that new prescription is headed over.
Gotcha. So, how long does it take to get the test results back when you do the blood draw or even the saliva? So how long does it take to get those results back?
So blood draws, usually if I'm not doing too complicated of a test, like some of the thyroid tests can be a little lengthy, but for the most part, in a day or 2. Yep, they get picked up and sent over to the lab. They run them, and then they send them over to me in my inbox. I review them, and then I'm typically sending an email and saying, hey, I got them.
Okay.
And then saliva tests. Saliva can be a little tricky because, and blood work too, but typically if a female is still menstruating, still getting periods, then we're checking on day 19 to 21 of their cycle just to make sure we get in the right phase, and we kind of base our numbers knowing what we're talking about,
right,
because we know what phase they are. And the saliva test can take, you have to wait till that 19 to 21. The saliva test is mailed in, and then I use ZRT. They take about a week.
Okay.
But they come back with a really great, they break everything down, tell you their recommendations. It's read by physicians. It's really a wonderful service. So I do like that lab company. But that one can take a little time. But if I do blood and then I just do the cortisol, it's pretty quick.
Gotcha. So, again, like I was just talking about the spitting. Yes. So I have done the test, and, I did a blood stick, and then I, just that spitting. I think that's the most, unappealing part of it. But the results after you're able to see, okay, this is why I feel this way.
Right.
Whether or not it be with a blood test or even going through the saliva, this is why I feel this way. It's very reassuring, and it's vindicating, really, because I'm not crazy, and this is real. Okay, we
do have capillary tests too that we can use that are pretty similar to saliva, reportedly. So
okay,
that's another option.
All right, wonderful. All right, so we're going to go to break, and we will continue to discuss this on our time back. See you then. And welcome back to the L Show. Today we are discussing grabbing testosterone by the testes. When we left from our last commercial break, we were talking about just how we, just some treatment possibilities and how we approach the patient with regard to going through labs, the follow up and the presentation of what sorts of therapies. And I'll say this, Josette, I really like your prescribing patterns. But before we discuss that, just make us aware of maybe some things that you consider when we are thinking about putting someone on hormones.
Right. So typically, safety first.
Yes.
I will have a patient, or I will ask them, when was your last mammogram? When was your last screening? Have you had your cholesterol checked? Because that's another thing that goes a little awry in
Yes.
menopause is your cholesterol levels.
Mm-hmm.
And again, this is not just about postmenopause. It's definitely before
Right.
as well. But making sure that your screenings are all up to date. I also ask, and on occasion, I'll ask for some clearance by a specialist. Say you had a pulmonary, like a blood clot somewhere or
Yes.
something like that. I want to make sure that we are treating you in the safest possible way. I will ask you to contact them and then show me the letter saying they're good to go. And there is some concern at the 10-year mark. So 10 years post-menopause, do we have an increased risk of cardiovascular heart disease?
Right.
So we just have that discussion and weigh risk and benefit and proceed from there. Knock on wood, everything great so far,
Right.
but we just want to be aware. Like I said, safety first. And I'm very cautious, even in my injecting and everything.
Yes.
I am very conservative, and either love it or you don't. But hey, that's
Listen,
me.
You got to be set. You have to do what's right.
Exactly.
Right? So, yes. And like I said, just going back into your prescribing patterns, I love them because, as a pharmacist, directly before I dispense something to a client, I'm thinking, okay, I want to get some additional counseling in there, some education, but also compliance, right? So they have gone through this whole process of, okay, this is my symptoms, this is what's wrong with me. We've looked at, they've looked at my levels. This is what I need. The last thing that we want to happen is this patient is not going to be compliant, so they will never be able to see the benefits of the therapy that we've gone through. So, we know the more difficult that regimen, the more likelihood of noncompliance. So, a woman who, is getting therapy for low libido and vaginal dryness is probably not going to want to be shoving and rubbing,
Exactly.
all day long, right? On all these separate medications. So, and your patterns really align with what compounding pharmacists do. We want to create, a medication that combinations, right? So if it can be combined, we want to combine it into some elegant, easy to use preparation.
Yes.
So
a swipe rather than pumping and rubbing.
Yeah, rubbing and shoving, right? So that is something that, we also just consider. And I say, just from a patient perspective, that is just so nice that some people just aren't, they just, I just do these 3 or 4 different things. No, that's just not something that we're already going through all this stuff in our lives, trying to deal with X, Y, and Z. Let's just make it simple.
Yeah. And it's great. I mean, how many times have I called you and been like, okay, what's going on here? Or, my patient said this, what do you think? And, bouncing things off each other is always, I am wonderful. A big proponent of community over competition,
Absolutely.
Especially in this area, there's a lot around, there's a lot of choices. So I just want to do the best.
Do the right thing, take care of people in the best way, and do what
and use my resources.
And use resources, exactly. So let's talk about some natural alternatives for patients who need hormone replacement, but they may not want to start with the traditional hormone.
Right. So I touched on DHEA before. That helps the support production of hormones. Magnesium helps with production of T and E.
Yes, T and E.
Yeah.
Yes.
And then what are some supplements you have in your
Yes.
locale?
So yes. So one of
And we
one.
might giggle.
I know we're it's
It's
coming.
coming.
It is coming. It is coming. So one of the supplements that I have is called Libido Health, and it is led by horny goat weed. So
There it
I
is.
know there it is, and it's horny goat weed, and that the blend the blend of that really aids in like the sexual motivation, stress management, and mood.
The ashwagandha.
Yeah,
Yep.
exactly. The hormonal balance, endurance, energy, and nervous system support. So that is one of the major um, natural alternatives for people who want to go on that side. And of course, DHEA.
Yep.
I offer that as well.
Can you say the real name of horny goat weed?
I don't even want to try it. It's like
there's a few letters, like a lot of letters and a few different words.
Exactly.
But it really is a weed.
It's a weed, and it's called horny goat. So we say, hey, listen, we got some horny goat weed. Can you guess what it's for? Yes, it just aligns very nicely with its name. So all right. So now I would like to just kind of bring it back to some of the things and questions that I've gotten over the week that I just want to, I think just the benefit of the listeners to answer on the air. So one of the questions that I got was, what if my provider is not very comfortable with the hormone therapy topic? Are you still willing to work with me and my provider? So I think what you just heard between Josette and myself, like, yes, like we communicate. I mean, ultimately it is about you getting what you want, and especially if the client loves their provider.
Right.
So
yeah, that's been some situations since I've been in the area for so long, working in primary care all that time. I know a lot of people.
Yes.
So I'll have a client come in to me and I'll be like, do you have a gynecologist or OBGYN or who's your primary care? And we have that discussion, are they willing to check these labs, or should we go ahead and do them on our end? And, I've had patients come back to me and say, oh, yeah, my provider knows you and said they trust you. And love to hear that. And that's, it's about a relationship. It's not about, me competing with their, primary care or their gynecologist. It's about working together to help the patient in the best way possible.
Exactly. And like, really, we think about like that triad, so provider, pharmacist, patient.
Right.
Like our goal is really the same. And so I can't imagine someone not wanting to do what's best, by the client.
Yeah.
Right. So
I guess it's a perspective on best because, certain providers may have been trained a certain way.
Right.
To not include we hear that a lot.
Yes.
When in med school, the OBGYN didn't have a class on that, or
right,
which is wild, but possible.
Right, exactly. So I think that kind of leadways me into my next question. Let's see. Sorry, I should have. Let's see. So there was an article that was in the news. Is a 2002 article concerning women and breast cancer risk.
Women's Health Institute.
Yeah. Yes. So could you kind of speak to that? What the article was about, and kind of what it talked about, and why what we do is a bit different from what that article is referring to.
Right. So it was the Women's Health Institute study 2002, talking about or studying hormones that was, abruptly just stopped. Can I say the name of the medicine? Well, there's one that we kind of allude to later on, but it was not bioidentical hormones, but, everything kind of gets lumped into that category.
Yes.
Talking about increased risk. And like I said, those are things that we look at. I want to make sure you're fully screened. You've had your mammograms. You don't have
Mm-hmm.
any
Mm-hmm.
risk for heart disease, and that kind of thing. So, yes, that was a real study, but it kind of reminds me of, and I hope I can say this,
Yes.
talking about the
Sure.
MMR study years
Yes.
ago,
Yes.
kind of, debunked a little bit later on.
Right.
That's what that makes me think of.
Gotcha. Okay. Okay. All right. So I really got to get this in here too. So non-hormonal options to help with vaginal dryness, so I can enjoy sex. So this is a question that I got, and the answer, of course, is yes. There are many things that we can use. Hydration is going to be the easiest. You would agree. And then we could do lubricants, combination vitamin E,
Right.
sodium hyaluronic acid, right?
Good for the face and
Yes,
good for the down below.
There
the
you
belt.
go. There you go. Moisturization and vitamin A. Can you think of anything else that we could tell our listeners that would be a non-hormonal option for vaginal dryness?
I think you covered them all.
Okay. All right. Cool beans. So I was thorough.
Yeah.
And okay, wonderful. Well, definitely, listen, it has been an absolute pleasure. I hate that our hour is over.
I know, it went so
but
fast.
It has been great. Thank you for coming on the show. Appreciate it so much. And again, if you want to see the show, again, you can go on Facebook and follow WSICnews.com. Have a great day.